Hello everyone, my name is Vitu. My group and I will be presenting about quality improvement in healthcare. My group members are Julie, June, Hima, myself, and Stephanie. To start with, we're going to talk about the history of quality improvement in healthcare. In 1995, a study has shown that as many as 16% of hospitalized patients experience adverse events during their admission, and out of these, 50% were preventable. This study has led to more attention to the safety and quality of Australian healthcare. In 2005, there was a national review into the governance and safety and quality in healthcare, which suggested that the health service were needed to be reformed to enhance quality improvement and open the door for the development of the national standards and its implementation. Also, during that time, the Australian Council for Safety and Quality in Healthcare was decommissioned and the establishment of the Commission of Safety and Quality in Healthcare. The Commission focused on three core principles: consumer centered, driven by information, and organized for safety. In 2006, the Commission developed the National Standard for Safety and Quality in Healthcare, which also known as National Safety and Quality in Health Service standards and was reviewed by stakeholders in 2008. The Australian National Hand Hygiene Initiative was also developed in the same year to tackle and improve hand hygiene compliance and reduce the risk of infection. The five standards were rolled out into consumer form and public review in 2008. These five standards were infection control and prevention, medication safety, patient identification, clinical handover, and governance. Due to feedback, five more standards were developed, which includes falls, pressure injuries, recognizing and responding to clinical deterioration, blood products, and consumer participation. These 10 standards were rolled out in 2010. These standards were also assessed for practicality and defined for implementation. In 2011, the standards were validated by the health ministers and introduced to health service with evidence-based resource and support materials. In 2013, the NSQHS standards were made compulsory by health minister in all hospital and day surgery services. During the first year of the implementation of the standards, 700 hospitals and day procedures services were evaluated. By 2017, 1,330 hospital and day procedure services were evaluated. The standards were formally evaluated, finalized, and reviewed by the University of Newcastle, University of New South Wales, and the Commission. So we're going to use the Australian Hand Hygiene Initiative as an example. A study has shown that there were 7,000 cases of Staphylococcus aureus bacteremia on average per year in Australia. 2 years after the initiative, the hand hygiene compliance rate was about 68%, with nurses having the best overall compliance rate of 73%, compared with other medical staff at just over 50%. This has seen a decrease in the SAP infection rate to just about 1 per 10,000 bed days. An 8 years longitude study has shown that after 8 years of the initiative, hand hygiene compliance rate climbed to over 84% overall, of which medical staff compliance rates are almost 72%. This has seen a decrease in hospital-acquired SAP to just 1,349 in 2016. It is estimated that for every 10% increase in hand hygiene compliance rate, there is a 15% decrease in SAP incidence rate. The Australian National Hand Hygiene Initiative involved the use of alcohol-based hand rub, monitor compliance in hand hygiene, education, and the measurement of infection rate. It has also promoted the 5 moments of hand hygiene, which involve hand hygiene before touching the patient, before a procedure, after the procedure, or after touching the patient, and after touching the patient's surroundings.
Over the last decades, there has been a significant rise of air carrier accidents in the aviation industry. These accidents occur due to diverted crew attention, such as unnecessary conversation, distraction from flight attendants, sightseeing, and radio calls. Eventually, this results in neglecting important tasks during takeoff and landing, such as flaps before taking off and extending the landing gear prior to landing. It has been demonstrated that human error is regarded as a main cause in 70 to 80% of all incidents and accidents in the aviation industry. Therefore, the aviation industry has established standardized systems to investigate, document, and disseminate errors and their lessons. As an initiative for the quality and safety improvement, the sterile cockpit rule was introduced. The rule was enacted by the Federal Aviation Administration Regulation in 1981. It refers to the time when non-essential activities within the cockpit is to be ceased. This means that the pilot cannot be distracted by any person such as crew members or things such as radio calls. Notably, the pilots are not even allowed to discuss or make conversations to each other unless it regards flight tasks. The rule is enforced twice during the critical phase of a flight: during takeoff when the cabin doors close to 10,000 feet, during landing from 10,000 feet down to the gate, or when the flight is on taxi mode. The stereoscopic rule has been successfully in decreasing accidents in the aviation industry, and it is now being applied to other industries, including healthcare.
The Australian Commission on Safety and Quality in Healthcare is Australia's key agency providing a range of safety and quality measures that are monitored and recorded at various levels of healthcare system to ensure patient safety and support health service providers and clinicians to improve the safety and quality of care. The National Safety and Quality Health Services Standards, the NSQHS standards, were developed by the Australian Commission on Safety and Quality in Healthcare, together with the states and the territories' government, the private sectors, clinical professionals, patients, and caregivers. The NSQHS standards aim to protect the public from harm and to improve the quality of services provided in healthcare systems. The NSQHS standards also serve as a quality assurance mechanism that examines whether relevant procedures and systems are in place to ensure that the standards of safety and quality are met. Implementation of standards is mandated in all hospitals, day procedure services, and public dental services across Australia. It has become mandatory for Australian health services to be accredited against the NSQHS standards from 2019. There are 8 NSQHS standards: clinical governance, partnering with consumers, preventing and controlling healthcare-associated infection, medication safety, comprehensive care, communicating for safety, blood management, recognizing and responding to acute deterioration. The clinical governance standard and the partnering with consumer standard are the requirement for the overarching system to effectively implement the remaining 6 standards. Quality improvement is a systematic and formal approach to measurable improvement in healthcare services and health outcomes of patients. Quality improvement programs involves various systematic activities that are organized and implemented by an organization to monitor, assess, and improve the quality of its healthcare. Quality improvement programs are reviewed and new programs are created periodically, so the organization continues to seek for higher levels of performance to optimize its care. Continuous monitor and improvement of healthcare activities can help healthcare organizations to function more efficiently, provide safer patient care, and generate better outcomes. Since the implementation of the first edition of the NSQHS standards in 2011, There has been many important improvements in the safety and quality of patient care documented, such as a decline in the Staphylococcus aureus bacteremia rate per 10,000 patient days under surveillance between 2010 and 2014, from 1.1 down to 0.87 cases. Better documentation of adverse drug reaction and medication safety. A decline in the national rate of central line associated bloodstream infections between 2012-13 and 2013-14 period, from 1.02 dropped to 0.6 per 1,000 line days. And greater prioritization of antimicrobial stewardship activities in health service organizations.
Patient safety is a core component of healthcare, with most health services engaging in activities to improve the quality, safety, and outcomes of the care delivered. It refers to the prevention and reduction of harms or risk of unnecessary harm to the patient during the process of receiving care in a healthcare setting. The goal of quality improvement in patient safety is to improve the health outcome of the patient, minimize harms, and prevent adverse events. This is done by 1. Understanding the complexity of the healthcare environment, 2. Using a systematic approach, and 3. Creating, trialing, and applying the changes using the real-time data for improvement. In the next slide, there is a short video that I really recommend you all to watch. It is based in Saratoga Hospital, located in the United States, where the Quality Improvement Project was implemented. A research conducted at the hospital showing the need for the use of technology to reduce patient likelihood of returning to the intensive care unit and to support nursing staff has the Philips IntelliVulgani solution. An automatic early warning scoring system was implemented to assist clinicians in identifying early signs of deterioration in a patient conditions hours before a potential adverse event occurs. Since implementing the project, there was a reduced in patient transfer to the intensive care unit and clinical codes such as Code Blue. Prior to this intervention, it was difficult to identify when patients were deteriorating, as nurses were not always able to pick up the indication. Now, please watch the video, and I hope it gives you an insight on how patient safety is improved through a quality improvement project.
We're in a very transitional time in healthcare. So our challenge was, how can we improve technology that we have in the hands of our nurses and create an environment in which we can all be successful and all deliver the best care possible to our patients.
I have a long line of nurses in my family. I was raised with the belief that it's a profession to be very proud of, making a difference in people's lives. We have the large multi-specialty unit, 41 beds. It's such a huge variety, and you're constantly kept on your toes. The first thing I do every day on my shift is to check the Philips Guardian. This system allows us to see which patients are trending abnormally and allows us to intervene earlier than we would have been able to in the past. What's going on, Tracy?
Her O2 sat went from 95 down to 85. Respirations also have spiked up to 35.
When a patient gets in trouble, we know before they get in deep trouble.
Is that feeling a little better?
And the best measurement for that is how many patients don't code in our building. If you walk into Saratoga Hospital, you'll see the Philips name on a lot of our technology. One of the things that our nurses have repeatedly said to us is the more we have technology to monitor our patients and keep them safe, the better care we deliver.
Good afternoon, Mr. Smith.
And so we at Saratoga believe that investment in that technology, we're not only serving the community, but as importantly, we're serving the clinicians who've chosen to work here with us.
We use the Guardian system every day, and every day we can intervene earlier because of it.
Innovation and you. Philips.
In 2010, the Australia Safety and Quality Framework for Healthcare was developed by the Australia Commission, focuses on three core principles for safe and high quality care as previously discussed in the first slide. These are as shown on the screen. Under each of these principles, there are many key areas for action, a total of 21, that all healthcare professionals must follow to improve the safety and quality of care provided to the consumer. I will be using the video from the previous slide as an example to demonstrate how it relates to the principle of patient safety. How does quality improvement project improve patient safety? In the consumer-centered, improved continuity of care is one of the areas for action. In the video, the use of the electronic-based clinical systems such as the Philips Guardian enables staff to record accurate and timely information about the patient health status, thus improving continuity of care. In the Driven by Information principle, we have Area 2.1, which stated that to use agreed guidelines to reduce inappropriate variation in the delivery of care. Quality improvement projects enable health professionals to inquire, integrate, and implement professional capabilities that are based on collaborative approaches and the use of a structured method that can improve the quality of the intervention. The Quality Improvement Project, implemented by Saratoga Hospital, helps reduces confusion and risk associated with the care delivered to the patient through the use of an agreed, well-constructed guideline that all health professionals need to abide by. In the last principle, Organized for Safety Areas of Action 3.2, 3.3, and 3.8 suggest health professionals take action for safety, managers and clinical leaders take action for safety, and take action to prevent or minimize harm from healthcare errors. Philips' IntelliVue Guardian system helps health professionals to recognize early signs of patient deterioration and to intervene hours before the occurrence of potential adverse events, thus achieving areas of action 3.2, 3.3, and 3.8.
Nurses have many roles in quality improvement, and different levels of nursing staff implement the quality improvement process. The role of Chief of Nursing is to implement the new practices for the nursing department to participate in the quality improvement goals. They transition the current nursing practices to the organizational goals for enhanced patient outcomes through strategic goals of communication to all nursing staff. They advocate and allocate resources that are needed to implement the QI processes. Furthermore, the Chief of Nursing supports and promotes education to help the nursing manager to incorporate quality improvement on their ward and provide skills and resources to accumulate the statistics and data in which will enhance the processes distinctive to the patient populations. The nursing unit manager's role is to communicate and operationalize the QI goals and processes of the hospital to the nurses on the ward. The nursing manager also recognizes the nursing-specific indicators that need improvement in accordance to the nurse's patient population and coordinates the QI processes accordingly to improve them. They also ensure that the nurses on the ward implement the new interventions for nursing care. The nursing manager also observes the nursing-sensitive indicators that are distinctive to the patient population on the ward and determining what can be improved through the use of evidence-based practice. The role of the nurses who are on the ward in regards to quality improvement is important, as they provide direct care to the patient and are the ones who implement the protocols and standards of the new organizational goals to demonstrate that it improves patient outcomes and care. If nurses did not implement these QI processes, then the outcomes would not be achieved. For improved patient outcomes to be accomplished, nurses need to follow the protocols and standards of care as determined by the best evidence-based practice that is available. The QI processes requires the nurses implement nursing care in the approach of nursing-sensitive indicators, in which is unique to the community that they care for, while in conjunction utilizing the standards and protocols that are proposed by the department. Although nurses play a vital role, it is essential to involve other healthcare professionals to collaborate in this approach of quality improvement for patient safety and outcomes as well.
The following websites refers to organizations in Australia that promote quality improvement in healthcare. The Australian Commission on Safety and Quality in Healthcare is an independent statutory authority which aims to promote better health outcomes and experiences for all patients and consumers and ameliorate value and sustainability in the healthcare system by leading and managing national advances in the safety and quality of healthcare. The Australian Institute of Health and Welfare is an independent statutory agency that monitors the performance of the health industry, ensures that their services are being delivered in Australia are effective, efficient, safe, and results in good outcomes for patients and the wider community. Lastly, the Australian Council on Healthcare Standards is a non-for-profit organization which aims to improve quality in healthcare, and it is Australia's primary healthcare assessment and accreditation provider. They work with caregivers, consumers, government, and industry shareholders to review and implement healthcare standards.
Quality improvement is used in all aspects of clinical practice. Some examples of this are hand hygiene, pressure injury care, and medication safety. Audits are used in clinical practice to compare the statistics of each year to determine whether there is an improved or decreased patient safety outcome. Hand hygiene in Australia is the most common practice among healthcare professionals. Each year, hospitals in Australia do hand hygiene auditing, validation, and reporting of the 5 moments of hand hygiene. The result of these audits determine whether healthcare professionals adhere to the 5 moments. If the results are not to standard, it therefore demonstrates the gap in knowledge of proper hand hygiene. The audits can also show improvements over time as a result of healthcare professional compliance and knowledge, resulting in improved patient outcomes and decreased hospital-acquired infections. Brockett and Shaban states that a hand hygiene audit in hospital demonstrated that the compliance rate of hand hygiene went from 22% to 71%, as evidenced by the increased use of alcohol-based hand gel. Pressure injuries are highly preventable, but are generally acquired during a patient's hospital stay. There are now tools to prevent and manage pressure injuries such as the Braden Score Scale, skin assessments, 2-hourly turns if the patient is identified to be at risk of a pressure injury or wound care management plan, and the pressure injury star classification to determine any present or developing pressure injuries. All of these tools are in adherence to the best evidence-based nursing practice. Again, audits are used to ensure that the right standards and protocols are in place to implement the best practice of pressure injury care. Ferguson and colleagues state that an audit they had completed demonstrated that there was gaps in practices between states in Australia, and although the pressure injury management assessment tools were used, management plans for them were not implemented. Medication safety is also another essential aspect in quality improvement to reduce medication errors and adverse drug events to the patient. Under Standard 4 of Medication Safety of the Safety and Quality Improvement Guide, the goal is to improve safety and quality use of medications, as well as to ensure that the clinician is competent in prescribing, dispensing, administering, and monitoring the patient for side effects. To reduce medication errors, audits are implemented yearly to promote high-quality care to patients in the clinical setting. Spuses and colleagues state that with yearly audits for medication safety in a mental health ward, there are considerable gaps in documentation of medication changes, as evidenced by no documentation in the patient's integrated notes, which is viewed by all healthcare professionals to determine if there are any changes in patient-related information. This gap in communication due to no documentation therefore puts the patient at risk, worsening the patient outcomes. There are many more examples of quality improvement that is involved in clinical practice that has been implemented and has increased patient outcomes. The purpose of audits is to enhance quality improvement in clinical practice, to compare and contrast previous results with current results, to determine if there is an improved outcome with patient safety.